Okay, chapter 20, Hematologic. So cancers, immunological, and neoplastic disorders. Disclosure, again, I do not own this material. I am only using this for my own nursing students, and all content within is for educational purposes for nursing students and does not provide medical advice. So, hematologic, neoplastic, immunological. So we're going to talk about the classifications of anemia, compare iron deficiency with sickle cell anemia, the major pathophysiology of kids with cancer, and identify the nursing assessments and interventions that would promote health during the care of cancer kids and their families. Developing a care plan for the child with cancer who is experiencing pain. Develop a caregiving education plan for high-risk oncology patients. Demonstrate an understanding of the pathophys and categories of hematopoietic stem cell transplant. Iron deficiency anemia, most common type of anemia, just not enough healthy red blood cells. So screening hemoglobin at 12-month health supervision visits. So until 12 months, they're not making enough of their own iron. They're getting it from their food. So at 12 months, it's time to start thinking about looking for iron deficiency anemia. So what would that kid look like? Irritable, anorexic, tachycardic, systolic murmur, brittle or concave nails, poor muscle tone, prone to infection, skin porcelain-like, edematous, retarded growth, decreased serum albumin, gamma globulin, and transferrin, and delayed learning. So anyone with delayed learning, we start thinking about this. Iron binding capacity of the blood, bringing oxygen to the brain. So the RBCs will be small in size, a low serum iron. So iron binding capacity being low, erythropoietin levels being low, reticulocyte hemoglobin content low. So some of the things we need to tell mom: liquid dosage of iron, sip through a straw to avoid discoloring tooth enamel. Iron supplementation may be necessary in adolescence, and using the Z-track method for the IM iron dextran. Most of the time, the commercial iron fortified formula is giving them enough. Iron supplements might not be needed. Again, avoid consumption of cow's milk until 12 months. Whole milk is recommended from 12 months to 2 years. For breastfed infants, we would go ahead and give them an iron supplement if they're not consuming enough iron-rich foods. So that being said, think about iron-rich foods that you would tell them to push. Always a good test question. So acquired thrombocytopenia, platelet counts decrease due to infection. So this would be Rocky Mountain spotted fever, tick fever, malaria, or bacterial, drug, or chemical exposure. Platelet count will recover when we know what is going on. So this is assessed for petechiae, spontaneous bleeding such as nosebleeds, blood in the feces, blood in the mucous membranes, petechiae, purpa, thorax, extremities, and their platelet count's going to be low, 150 to 450. And provide mouth care with soft touthettes, monitor stools for occult or frank blood. So some of the preparations of iron are on table 20.1. So ferric gluconate ferrous fulminate, folic acid, iron dextran, and iron sucrose are on there. Folate, folic acid, iron comes from organ meats, shellfish, poultry, legumes, molasses, and fortified cereals. Folate comes from legumes, liver, dark leafy vegetables, lean protein, lean beef, and potatoes. So avoiding IM injections, suctioning, avoid aspirin, avoid steroids, modified age appropriate activities to avoid injury, collaborate with a physical therapist, especially if they've been in bed a long term, and a positive self-image and self-care. These kids have possible fluid retention and weight gain, steroids given with food, limit sodium intake, encourage the parent to support a positive self-concept of the child. Moving on to sickle cell, you need to know this. Sickle cell is the most common genetic condition. Abnormal hemoglobin S for normal hemoglobin A. It deforms the red blood cell, changing it from round to crescent shape. Tissue damage can occur all over the body. Complications, delayed growth, sex maturity, pulmonary functioning, stroke. Aseptic necrosis of the hip and shoulders, retinopathy, dermal ulcers, severe or chronic pain, and psychosocial dysfunctioning. So when both of the parents have the sickle cell trait, each pregnancy carries 1 of 4 chance to have sickle cell. 1 in 13 Black babies born with sickle cell. So they're asymptomatic until about 4 to 6 months because of the presence of fetal hemoglobin, which resists sickling and suppressing symptoms. And then when the sickled shaped shells replace the fetal hemoglobin at 5 months is when you start seeing issues. So just not enough red blood cells to carry oxygen and flow smoothly through the vessels. Vaso-occlusive crisis is painful episode with hand-foot syndrome, causing symmetrical infarct of the bones of the hands and feet and painful swelling of the soft tissues. Could look like pulmonary infiltrate, chest pain, fever, cough, tachypnea, wheezing, and hypoxia. And that sequestration of all those blood cells are going to cause spleen enlargement. A CVA with twitching of the face, arms, legs, seizure, change in speech, weakness in the hands and feet, and abnormal behavior. So long periods of hospitalization. So analgesics for the pain, IV therapy, oral fluids, activity rest cycles, pain distraction, antibiotics for the infection, penicillin prophylaxis. Hydrourea is cytotoxic. So moderate to severe crisis, they might use it. The PT, self-talk, humor, using cognitive behavioral approaches. Splenectomy, potentially life-saving. A stem cell transplant might be an option. And monitor for acute symptoms of possible severe chest, back, abdominal pain, fever, congested cough, retractions, tachypnea, dyspnea, decreased oxygen saturation, and administer blood transfusions for the treatment of anemia. Again, religious cultural beliefs for the blood transfusions. Not everybody will accept them, so how do we deal with that as well? Being able to give erythropoietin. Aplastic anemia is the deficiency of formation of blood elements. Fatigue, illness, injury that doesn't heal. This is damage to the 3 blood cells that are produced within the bone marrow. So immunosuppressive therapy, blood transfusions, IV transfusions, and prevent infection with hand hygiene, bone marrow aspiration. You've got immature reticulocytes coming out early. Go back into skills 3.0 and go over blood transfusion. So typically we do a set of vitals before, within 30 minutes of the transfusion, 15 minutes after, and 1 hour later, monitoring the child for 15 minutes, assessing for temperature changes, stop the infusion, obtain a new IV set, administer meds as ordered, and send the urine to the lab. So this type, we're supporting the balance of the diet, including meat substitutes, dried fruits, green leafy vegetables, legumes, egg yolks, seafood, whole grain, and nuts. Hemophilia is a deficiency in factor VIII and types A and B. So the defective factor is unable to do its job in the clotting cascade, so the cascade is halted and the fibrin clot is unable to form, leading to uncontrolled bleeding when injury occurs. Hemophilia A and B are inherited as an X-linked recessive trait, which affects males. Females are carriers but don't have the disease. So that's a history of bleeding, nosebleeds, bruising, arthritis in the joint cavities, hematoma, and spontaneous hematuria. PTT could be up to 25 to 35 seconds. Often no bleeding in the first year of life until they start walking and falling. And the oral mucosal membrane bleeding is the most common first injury. So administration of factor VIII, corticosteroids, NSAIDs that will interfere with the platelet formation. Avoid aspirin, avoid chronic use of codeine, and supportive care with exercise and PT. Helmet use, soft toothbrushes, venipuncture, medic alert tag, and you're going to give them a diet high in vitamin K. So broccoli, cabbage, cauliflower, greens, kale, spinach, leaf, lettuce, watercress, parsley, other raw green leafy vegetables, pork, liver, soybeans, mayonnaise, and vegetable oils. Lead poisoning, they love to give you this question because we still have homes with lead paint in them. Children with iron deficiency absorb lead more readily than those with sufficient iron stores, so that's why they're more susceptible. So lead poisoning, there should be risk assessments performed at 6, 9, 12 months, 18 months, 24 months, and 3, 4, 5, 6. Any interior, exterior paint, plaster, caulking, soil, foods, liquids, water from leaded or copper pipes, cigarette butts and ashes, colored newsprint, unglazed pottery, painted lead, crib rails, and window ledges. Inhalation, if they're around lead-based paint surfaces, burning of automobile batteries, burning of colored newspaper, automobile exhausts, sniffing leaded gasoline, cigarette smoke, and dust. So CNS system signs and symptoms of this would be hyperactivity, impulsivity, lethargy, irritability, loss of developmental progress, hearing impairment, and learning disabilities. Signs of anemia, abdominal pain, vomiting, constipation, anorexia, headache, fever, and lethargy. Any level greater than 5 is above the reference range. Make sure you know the different blood transfusion products in table 20.3. Again, it's more than just red blood cells. When you have a lead level of over 45, it requires chelation therapy, and levels over 70 cause brain damage. So look up chelation therapy. It's actually injections of calcium disodium ethanoate in a large muscle mass. And then prevent further lead. So removal of lead in the house, paint chips, dust, and instruct parents on lead safety. All right. So iron deficiency anemia is characterized by iron deficiency. They're probably pale. So pale RBCs, depleted iron stores with decrease in bone marrow erythropoiesis, the making of new red blood cells. All right, HIV. AIDS develops from HIV infection, which is most commonly transmitted to kids during utero with a mom who has HIV. Using preventative medicine during pregnancy can reduce the risk. So age 13 to 24 accounts for 22% of the new HIV cases, and most new cases were among gay and bisexual males. The HIV virus infects T lymphocytes in blood, semen, vaginal secretions, and breast milk. So acute infection increases the viral load. Viral load will decrease slowly in infected children. So assessment, lymphedema, mucocutaneous eruptions in the mouth, failure to thrive, delayed development, hepatosplenomegaly, oral candidias, recurrent diarrhea, blood spot test. We'll also do the ELISA and the Western blot. So improved efficacy, minimized toxicity, and delayed drug resistance in the new antivirals. Immunization is recommended, certain vaccines, nutritional management, confidentiality, and prevent and manage opportunistic infections. Oncological disorders, the spread of abnormal cells. So neoplasm, uncontrolled abnormal growth of cells. So one of the biggest ones of these is tumors or malignant. Cause of most cancers are unknown, possibly chemical carcinogens, radiation, and viruses. So unregulated genetic activity and tumor growth in Wilms tumor. Neuroblastoma, retinoblastoma, early childhood diseases. Wilms tumor of the kidney is usually discovered by caregivers noticing a lump in the abdominal area while dressing or bathing the child, where adolescents are more Hodgkin lymphoma and osteosarcoma, bone cancer. Hodgkin's lymphoma is a treatable disease with a cure. That's a realistic goal. So you can see in the book, retinoblastoma, cachexia, weight loss with anorexia, anemia, infection, bruising from uncontrolled bleeding, and hematuria. So make sure that you know how to do an ANC. The percent of bands plus the percent of segmented cells times the red blood cell is the ANC. So the ANC, when it's less than 500, they're at risk for infection. So how would we do this? Typically, we're going to go ahead and do lumbar puncture, rule out. So lumbar puncture, please know how they are positioned. Bone marrow aspiration, know how they do it. So plan of care, complementary medicines might be used. Um, Administration of meds for nausea and vomiting. IV fluid replacement for emesis loss. Nutrition and calorie. Might need a port. Listen, debrief, and offer support daily. The child might act out procedures on a doll, computer simulation video. Some of the life-threatening emergencies: tumor lysis syndrome, where the destruction of tumor cells releases uric acid, potassium, phosphate, and calcium. Septic shock from overwhelming infection. Hyperleuctosis and intracranial pressure with brain tumors. Radiation therapy, just know that skin erythema, ulceration, alopecia, learning difficulties, attention difficulties, headache, edema, dry eye, cataracts, retinopathy. Radiation burns are treated like a sunburn. No ointments, loose clothing. Leukemia is a group of malignant diseases of the bone marrow and lymphatic system. So they present with anemia, with weakness, fatigue, pallor, dyspnea, cardiac dilation, and anorexia. It's the most common form of pediatric cancer. 28% of all pediatric cancers, and the survival rate in recent years has improved. Target cells being hit. So different types of leukemia, acute and chronic, are in table 20.4. Thrombocytopenia, know that. TP, ITP, always on the test. So blood transfusions. Avoid plants, exposure to fungus, teach hand hygiene, prevention of infection, chemotherapy, and blood transfusions. Lymphomas, Hodgkin's and non-Hodgkin's. Again, they are on table 20.5 and 20.6. Fever, weight loss, night sweats, colds, coughs, abdominal discomfort, anorexia, nausea, and pruritus. So you're doing CBC, coag studies, erythrocyte sediment rate, liver functions, uric acid, CT scans, Gallim scans, lumbar puncture. Again, chemotherapy, radiation. Bone marrow aspiration, know how they do it and what position to put the child. And then caregiver education, just monitor activity level, give them rest. High risk for sterilization, so sperm banking. Teach about the disease, the toxicity, drug reactions, and discuss feelings of their disease process. Hand washing, hand washing, hand washing. Brain tumors. So depends where they are. So a solid tumor. Medulloblastoma starts in the cerebellum. Could spread to the spinal cord, spinal fluid, obstructive hydrocephalus. Glioma is a term for any cancer that comes from the glia cells. They hold the nerves in place and protect from infection. Glioma can form in the brain, brainstem, and spinal cord. It's a star-shaped brain cell called astrocytes. Pediatric tumors differ depending on where the tumor starts. So ICP, pulse pressures, pupils sluggish, dilated, unequal hand grips, nausea, vomiting, the biggest things for ICP. MRI, CT, lumbar puncture, brain tissue removal. And then just consider the developmental level of the child. It's okay for the baby to cry. Share a special box of toys. And then radiotherapy is going to help shrink. Monitor blood pressure, temperature, seizures, sore mouth, stomatitis, vomiting, IV fluids, and then teaching the parents about the plan of care, the survivability rates, social connection with family, friends on the phone, text, video chats, media platforms. They may experience challenges with memory, motor skills, learning behavior, and should be monitored during puberty for hormones and healthy growth patterns. Wilms tumor, on the other hand, usually the parents will find a lump around the waistband or diaper area, often during bath time, and they affect one or both kidneys. The lump is located in the abdomen area, might have pain associated with the lump, increased blood pressure because of the changes in the renin-angiotensin syndrome system, and then have fever for no reason. So CT scans don't palpate the site. Blood pressure is obtained. Manual blood pressures are indicated. So again, looking at table 20.8, they're rare when they do happen. In figure 2011, you see arm board in use for the IV on the child in blue so that he doesn't rip out his IV. If they're in a strategic location that we might lose the IV, we'll put them on an arm board, and that's not considered a restraint. So Wilms tumor kids, assess INO, chemotherapy, strict aseptic technique with central venous lines, monitor nutrition, and wear clothing that's loose around the waistband. Educate parents about chemotherapy, removing of the tumor, get them in with the American Cancer Society, genetic counseling, avoid pushing or lifting the tumor area. Don't palpate the tumor because it could proliferate the spreads of the cancer cells. Hematopoietic stem cell transplant is a lethal dose of chemotherapy to kill the cancer cells and suppress the bone marrow production. The body is resupplied with stem cells. Disease-free marrow replaces cancerous marrow. So they are given an autologous collection of stem cells with an apheresis machine. Adolescents, just know that there might be issues with keeping them on their medications. They may have a mind of their own. They may be fatigued, social isolation, friends influencing the behavior of the child. So lots of education around that. So lymphoma that occurs in the peripheral lymph nodes and spreads to tissues throughout the body. Non-Hodgkin's. All right.